Hello, welcome back to Physio Lectures. So today's video is on hernia. So basically first definition and types of hernia. A hernia occurs when an organ or fatty tissue squeezes through a weak spot in a surrounding muscle and connective tissue called fascia. So basically what's happened in hernia, the organ or fatty tissue squeeze through a weak spot in a surrounding muscles or connective tissue called fascia. There are common type of hernia which are inguinal hernia, which is also known as inner groin hernia, incisional hernia which results from an incision, femoral hernia in the outer groin, umbilical belly button hernia, and hiatal upper stomach. So the location of the hernia is described according to their name, like inguinal is in inner groin, femoral outer groin, incisional resulted from incision. So the name suggests the type of hernia. First, the inguinal hernia. So what happened in the inguinal hernia? The intestine or the bladder protrudes through the abdominal wall or into the inguinal canal in the groin. So basically the intestine and the bladder will protrude out through the abdominal wall or into the inguinal canal. That's why it is known as inguinal hernia. About 96% of the all groin hernias are inguinal, and these are most common in men because of the natural weakness in this area in men. There are two type of inguinal hernia. One is direct and second is indirect. So as the name suggests, in a direct inguinal hernia, there is a bulge from the posterior wall of the inguinal hernia, whereas in indirect inguinal hernia passes through the inguinal canal or the groin. So inguinal hernia, first of all, in this intestine or bladder protrude out through the abdominal wall into the inguinal canal. About 96% of the hernia are inguinal hernia, most common in male, and there are two type of inguinal hernia, direct and indirect. In the direct inguinal hernia show a bulge from the posterior wall of the inguinal canal, whereas indirect inguinal hernia passes through the inguinal canal or the groin. Next is femoral hernia, which is also known as outer groin hernia. So in femoral hernia, it occurs when the intestine enters the canal carrying the femoral artery into the upper thigh. Femoral hernia are most common in women, especially those who are pregnant or obese. So it, as the name suggests, it occurs in a canal carrying the femoral artery into the upper thigh region. Next is incisional hernia. Now the incisional hernia, in this type of hernia, the intestine pushes through the abdominal wall at the site of previous abdominal surgery. This is a most common in elderly and overweight people who are inactive after the abdominal surgery. So basically their abdominal muscles get weak, and due to which the incisional hernia can occur. Now next is umbilical hernia. In this type of hernia, part of small intestine passes through the abdominal wall near the navel. Common in newborns, and it is commonly afflicts the obese women and those who have had many children. Next is hiatal hernia. So hiatus is an opening of the diaphragm. So hiatal hernia, it happens when the upper stomach squeezes through the hiatus, and opening in the diaphragm through which esophagus passes. So what happened? There in the diaphragm there is an opening known as hiatus, and from that hiatus the esophagus passes from the thoracic to the abdominal cavity. So when the weakness of that muscle occur, the weakness occur at that region, then it upper stomach squeeze through the hiatus and an opening in the diaphragm through which the esophagus passes. So upper stomach squeeze through that opening. This is known as hiatal hernia. So there are the types of hernia which I already explained you is shown here. So first of all, epigastric upper abdominal at midline, incisional hernia, umbilical hernia at navel, direct inguinal hernia, then indirect inguinal hernia, then this is the femoral hernia or the outer groin hernia. So these are the basic locations which are common for the hernia. Next, risk factor for the hernia. First, if there is a family history of hernia, then there may be chances of getting hernia. Males are more affected than females. Next is obesity. Pregnancy, like in some types of hernia which occurs only due to the pregnancy. Weightlifting, coughing, straining during wall movement. Cystic fibrosis and chronic lung infection. Previous abdominal surgery cause the incisional hernia commonly. So these are the basic risk factors for the hernia. So while patient come with some kind of symptoms of hernia, so we need to check this risk factor as well. Symptoms. The first symptom of hernia is usually the small bulging under the skin that is generally painless, but may produce discomfort or get larger during the strenuous activity or coughing. So usually there is a small bulging under the skin, and this bulging is basically painless, but sometimes with some strenuous activity or coughing, this bulging produce some discomfort. At this stage, the hernia is reducible because its content can be pushed back into the abdomen. However, if hernia grows, it may become incarcerated, unable to push back. If blood stops flowing through the incarcerated bowel, this results into strangulation, which is accompanied by pain and often with nausea, vomiting, and constipation, and surgical management is needed or operative management is needed for the strangulation. Now, complication. A hernia may result in entrapment of other organs such as bladder or colon or nerves, producing constipation or problem with urination or sexual function. A strangulated hernia is a surgical emergency because part of the bowel may become necrotic due to insufficient blood supply, resulting in life-threatening peritonitis, inflammation of abdominal cavity, needing surgical removal of part of the bowel. If you have a hernia and a significant abdominal pain over the hernia, or nausea or vomiting, you should seek the medical care immediately. Now for the treatment. Initial treatment is a minor hernia includes avoiding heavy lifting or strenuous exercises, slowly build up the muscles, and sometimes wearing a sport or truss or girdle. This used to be thought that all hernia should be repaired. However, recent evidence suggests that repair should be performed only if significant discomfort or pain is associated with the hernia. Now, there are two types of operations. One is herniorrhaphy, closing the gap in muscles, and next is laparoscopically. So first, the traditional method in which herniorrhaphy is done, closing the gap in muscle. So when the gap is large, a plastic mesh may be used for reinforcement of muscles of the abdominal wall. Use of mesh reduces the risk of the hernia reoccurring, but the material which is used in the mesh can become infected. In some cases, hernia repair may be performed with a laparoscope, so laparoscopically through a small incision using a fibroraptic tube with the camera and small instrument. Although this approach has not been shown to be better than traditional open operations, still the research is going on that which method is more good. In some papers, herniorrhaphy is more good, while in some the laparoscopic method is better. So all this information is taken from these two articles, and if you want to read more about the abdominal hernia, you can read these articles and some more articles available on various websites. If you like my video, please like it and share it, and also subscribe my channel for more such videos. And if you have want a video on any other specific topic, then please suggest the topic in a comment section. Thank you.